A few months before most of us knew the word coronavirus, I interviewed a leading cellular biologist at Harvard Medical School, Dr. Stephanie Taylor, on how people can protect themselves from the flu. Her answer was surprising: properly humidify your indoor spaces, starting with your own house. This can lower your risk of infection by as much as 60%. Now she has an update: the same advice holds true for the virus that causes COVID-19. Flu cases rise every winter, just as the pandemic is spiking now. But Dr. Taylor says that's not because of the cold, outdoor winter temperatures, but how we act in wintertime. We seal ourselves indoors with the heat on, which dramatically dries the air. According to fairly recent research on the behavior of airborne pathogens, droplets carrying infectious virus or bacteria shrink rapidly in low humidity and become dormant. However, the virus or bacteria can remain highly infectious. When the tiny airborne aerosol is subsequently inhaled into the moist airway of a human, the tiny floating devils are rehydrated and cause colds, the flu, and COVID-19. But don't blast your humidifier without monitoring the results. Excessively high levels of relative humidity are also unsafe, she says. In that situation, warm and overly humidified air can encounter a cold surface, which results in condensation. That provides the liquid needed for mold to grow. Our bodies also respond to low humidity levels in ways that can make us much more susceptible to infection. The combination, air that promotes viral spread and bodies susceptible to infection, mean that indoor spaces can actually accelerate the spread of disease. The trick is to achieve indoor humidity at a level that's just right, not too dry and not too humid. According to Dr. Taylor, keep indoor relative humidity levels maintained at 40 to 60%, ideally as close to 50% as possible. This is fairly simple to accomplish. Use a hygrometer, a sensor available online for about $5 to $10, to know when to adjust your humidifier. That's it. This works in every home, office, business, hospital, train, plane, gym, daycare, school, church, synagogue, mosque, and everywhere people inhabit. The studies that support Dr. Taylor's advice are well designed and compelling. So why don't we know about them? Dr. Taylor believes there's a leadership vacuum in the cracks between two very different professions: building design and public health. Architects don't monitor building interiors for effects on human health. Public health authorities don't include building management in their job descriptions. But if the abundant literature is right, this oversight has the potential to make things worse. Stay-at-home orders might backfire if we stay in poorly humidified homes. As it turns out, Dr. Taylor is one of those rare professionals who is both a building design expert and a public health expert,